In today's class, we'll discuss about one of the important topic of the nervous system, that is parasympathetic nervous system. Here in autonomous nervous system, we have observed that there are two nerve emergings, that is efferent nerves and efferent nerves. So efferent nerves are those which sends impulses to the central nervous system, as well as efferent nerves are those which receive the impulses. So here these autonomous nervous system has two branchings, parasympathetic as well as sympathetic nervous system. So here we can see the diagrammatical representation where the parasympathetic nervous system, the emergings or else the outflow of the parasympathetic nervous system shows effects like constriction of pupil, increased saliva production, reduced heart rate, constriction of bronchioles, as well as constriction of urinary bladder, etc., which is quite opposite to that of the sympathetic nervous system. Let us see the location of this parasympathetic nervous system. So this parasympathetic nervous system is present in the cranial as well as sacral region of the spinal cord. So in the cranial region, it is emerging out of the cranial nerves of 3, 7, 9 and 10, and when you see the sacral segment of the spinal cord, it is emerging out of S2, S3 and S4. So that is the reason it is called as craniosacral outflow. Here we can see the emergence of the parasympathetic innervation itself. So it is emerging out of the in the cranial region as well as sacral region, and it is showing various effects on different organs. So the effect of this parasympathetic nervous system differs from organ to organ. In parasympathetic nervous system, so there are the neurotransmitters which are present in the body. So in parasympathetic nervous system, acetylcholine is considered to be a neurotransmitter because acetylcholine will bind to the receptors which are present in this parasympathetic nervous system. So the drugs which mimic the action of this parasympathetic nervous system are called as parasympathomimetics or cholinergic agonists or cholinomimetics, whereas the drugs which antagonize the action of parasympathetic nervous system are considered to be parasympatholytics, cholinergic antagonists as well as cholinolytics. Here, how the neurotransmission is taking place in the cholinergic neurons, we will see. Here, first the synthesis of acetylcholine is taking place. So, acetylcholine is synthesized from the acetyl coenzyme A and choline. So, here after the synthesis of acetylcholine, it is stored in the vesicles. So, here after the storage, whenever it is necessary or else when there is stimulation of this parasympathetic nervous system, the acetylcholine is released from its storage vesicles, and thereby after the release of this acetylcholine, it is undergoing metabolism with the enzyme called as acetylcholinesterase. So this is the enzyme which metabolizes acetylcholine to acetic acetate as well as choline. So after that, it is going in binding to the cholinergic receptors and exerts its actions. So after the binding of the acetylcholine to the receptors, so whatever the leftover acetylcholine molecules are there, they get reuptake. So with this reuptake mechanism, the acetylcholine is released again from the synaptic nace. Here we can see the metabolism as well as synthesis of acetylcholine from acetyl coenzyme A. When acetyl coenzyme E is binding with the choline, it forms acetylcholine with the help of an enzyme called choline acetyl transferase. And after the formation of acetylcholine, it is metabolizing to acid acetate and choline with the help of enzyme called as acetylcholinesterase. Here we can see the pictorial representation. Acetylcholine, once formed, it is stored in the vesicles. After the storage, it is released into the synaptic cleft, and whereby it is going and binding to the respective cholinergic receptors and exerts its action. So whatever the leftover acetylcholine is there, it is undergoing the reuptake mechanism. Here in parasympathetic nervous system, there are two types of receptors. So one is muscarinic receptors and the other one is nicotinic receptors. So these muscarinic receptors are of G protein coupled type of receptors, whereas nicotinic type of receptors are ion channeled receptors. So here these muscarinic receptors, they are usually present in the autonomic neuroeffector junctions, and thereby the muscarinic receptors are mainly present at these junctions, and thereby they aid in the release of acetylcholine. Whereas if we see nicotinic receptors, they are present in the neuromuscular junction as well as ganglionic junction ganglia, or else we can say ganglionic junction, and thereby the acetylcholine will bind to those particular receptors which are present in the ganglia as well as neuromuscular junction. Let us see the cholinergic receptors. So these cholinergic receptors are mainly of two types, muscarinic and nicotinic. Where if we see muscarinic receptors, they are again of 5 types: M1, M2, M3, M4 and M5. If we see nicotinic receptors, they are of 2 types again, NM and NG or NN. So this subscript indicates the location of the nicotinic receptor. So NM indicates the nicotinic receptors which are present in the neuromuscular junction, whereas NN or NG refers to the nicotinic receptors which are present in the ganglia of the neurons, or else we can say the nicotinic receptors which are present in the neuron ganglia. Here is the tabular format. See, the M1 type of receptors, these M1 type of receptors, they are mainly located in the nerve endings, and they are of G protein coupled receptors. So these G protein coupled receptors are having a structure of 7 helical strands, 7 helical transmembranes. So in between the plasma membrane, they are having 7 helical transmembrane structure, and with that, whereby the the mediation of the receptors will be taking place. So it is a 7 transmembrane segments, and this is of GQ type. So in the G protein coupled receptors, there are various types: GQ, GI, GS. So this M1 type of receptor is GQ type of GPCR receptor, and it is mediated through the action of IP3 and DAC cascade. So in the GPCR receptors, there are 2 pathways where the mechanism can be shown. One is cyclic AMP pathway, and the other one is inositol triphosphate and diacylglycerol pathway. So here M1 type of receptors are following, or they are showing their actions by with the help of a mechanism of IP3 and DAC cascade, and the agonists of this M1 receptor are oxotrimorin and MCN343A. So this is a chemical compound which is not named yet, but it is shown to have M1 muscarinic, anti-muscarinic, M1 agonist effect. So the antagonists of M1 receptors are pyranzapine and tilanzapine. And when coming to M2 receptors, these are present in the heart, nerves as well as smooth muscle. These are also GPCR but GI type of GPCR receptors, and they are exerting their actions with the help of a mechanism of cyclic AMP. So the inhibition of cyclic AMP levels takes place, thereby showing the muscarinic effects or as cholinergic effects. So the agonist of this M2 receptor is methacholine, as well as the antagonist is methactramine and tryptamine. So these are the antagonists of M2 receptors. When coming to M3 receptors, so these M3 receptors are present in few glands, smooth muscles as well as endothelium, and this is also a G protein type of receptors, but the subunit is GQ, and this also follows the pathway of IP3 and DAC cascade. The agonist is bethanicol, as well as the antagonist is dariphenacin and hexahydroxylide phenidol. So these are the antagonists of M3 receptors. So here, but M4 and M5 receptors are not clinically useful, but these M4 and M5 receptors are present in the CNS, and they are also GI as well as GQ type of GPCR receptors, and they this M4 type of receptor, it follows the inhibition of cyclic AMP pathway, whereas M5 receptor will follow the pathway of IP3 and diacylglycerol. When coming to nicotinic receptors, this NM type of receptor is present in the skeletal muscle or neuromuscular junction, and these are ion channels. So ion channels are the pentamer structures. They are having 5 subunits in them, that is alpha, beta and gamma subunits, and they allow the entry of ions to pass through them, and thereby the mechanism, or as we can say the effects of these nicotinic receptors can be observed. So this NM type of receptor is a pentamer, that is a 5 subunit structure which is of ion channel gated receptor, and this shows the effect of sodium and potassium depolarization. So here these ion gated channel receptors also show various actions. Few show their action by by entry of sodium and potassium through them, and few show the mechanism of calcium. So here these nicotinic type of receptors, they show the depolarization effect of the receptor by the entry of sodium as well as potassium through them. So here the agonist is PTMA and the nicotine. So these are the agonists of NM type of receptors, and the antagonists are tubocurarine and alpha bungarotoxin. And the NN type of receptors, these are present in the CNS, or else we can say they are present in the post-ganglia. So the post-ganglia cell body contains these nicotinic type of receptors, and this is also a pentamer structure, but it is having various subunits when compared to NM type of receptor. And this also follow the mechanism of sodium and potassium depolarization. And the agonist of this NN type of receptors are DMPP and nicotine again, as well as the antagonists include hexamethonium and trimethophan. Let us see the classification of this parasympathomimetics or cholinergic drugs. So these are classified into two types, directly acting and indirectly acting. So what are these directly and indirectly acting? So directly acting drugs are those which inhibit the binding of acetylcholine to the receptors, and these drugs go and bind to the cholinergic receptors. And indirectly acting drugs are those which inhibit the release of acetylcholine, and thereby the acetylcholine won't be even released into the synaptic cleft, and if it's not released, then it won't bind to the receptors and exert the action. Directly acting cholinergic drugs are again divided into two types, that is cholinesterase as well as cholinomimetic alkaloids. Here the cholinesterase. So these are the compounds which exactly mimic the structure as well as action of the acetylcholine. So if they mimic the structure of acetylcholine, then definitely they go and bind to the receptors instead of the acetylcholine. So in this way they exert their cholinergic action. So here the cholinesters. So these are the drugs like acetylcholine, methacholine, carbachol and bethanicol. So these have the same structure as that of acetylcholine. So if they bind to the even the receptors also, the cholinergic receptors also, they exert the same action of acetylcholine. The cholinomimetic alkaloids. So here the cholinomimetic alkaloids are of two types again, muscarinic agonists as well as nicotinic agonists. Here in muscarinic agonists we can see the natural alkaloids which are obtained from the plant source and the synthetic alkaloids which are synthesized or derived synthetically. So the natural alkaloids include muscarine, pilocarpine as well as eracholine, as well as synthetic alkaloids include oxotremorin. And if we see nicotinic agonists, these are also having natural as well as synthetic compounds. The naturally obtained nicotinic agonists are nicotine and lobeline, as well as synthetic alkaloids include DMPP, that is dimethylphenyl pyrazapine. These indirectly, if we see indirectly acting cholinergic drugs, so these indirectly acting cholinergic drugs are categorized as carbamates, alcohols and miscellaneous drugs. So what are the drugs which come under the category of carbamates? So it includes physostigmine, neostigmine, pyridostigmine, tacrine, ambinonium and demacarium. So these are the drugs which are come under the category of carbamates, and these are indirectly acting drugs, in the sense these drugs influence the release of acetylcholine from the storage vesicles. And alcohols include edrophonium, and miscellaneous drugs, there are other drugs like galantamine, donepezil and rivastigmine. Here in indirectly acting drugs, we can see the reversible drugs and irreversible drugs. So reversible drugs are those like the action of the receptors can be reversed again. In the sense the action of the drugs or the receptor action can be reversed again. But here there are irreversible drugs which do not allow the receptor to show its action again. The drugs include ecothiopate. So this is only the clinically useful irreversible drug of cholinergic category, and there are other drugs like serine, tubin and soman. So these are considered to be war gases. So these are used only during wars. And there are insecticides like parathion, malathion, DFP, TEPP and OMPA. So these are few of the insecticides which are having cholinergic action. Here we can see the individual drug that is directly acting acetylcholine, or else we can say directly acting cholinergic drugs. So the acetylcholine. So the structure of acetylcholine, if we see the individual structures, we can see the structures are same that of acetylcholine. So they are having a nitrogen group which is attached with 3 methyl groups, and a C double bond O, that is a ketone group, is present in their structure. So these are two main groups which determine the action of that particular compound. So this acetylcholine is having the equal affinity towards muscarinic as well as nicotinic. We can say it is highly it is having highly affinity towards both the muscarinic as well as nicotinic receptors, and the hydrolysis by the acetylcholinesterase. So as I told you, acetylcholinesterase is an enzyme which hydrolyzes acetylcholine. So it is highly susceptible, or else we can say the acetylcholinesterase completely metabolizes or hydrolyzes the acetylcholine, and this acetylcholine is not having any clinical use. And if we see the other drug, carbachol, so this carbachol is also having muscarinic and nicotinic affinity, but the affinity towards the nicotinic receptor is greater when compared to that of the muscarinic receptor. But the characteristic feature of this carbachol is that it is not hydrolyzed by the enzyme called acetylcholinesterase. So the availability of that drug towards the receptor is more, but unfortunately this drug is also not clinically applicable. And methacholine. So methacholine is a drug which is having greater affinity towards muscarinic receptor rather than the nicotinic receptor, and this is also not hydrolyzed by the enzyme acetylcholinesterase, and this is also not having any clinical applications. Let us see the other drug, bethanicol. So bethanicol is a compound which is having greater affinity towards, we can say it is M1 receptor, we can say it is an selective muscarinic receptor agonist. So because it only binds to the muscarinic receptor and it does not bind to the nicotinic receptor, and it is not even hydrolyzed by the acetylcholinesterase enzyme. That is the reason it is clinically used in the treatment of bladder and GIT disturbances. And the other drug is muscarine. So muscarine is a natural plant alkaloid, and it is having a structure of we can say it is having a 5 carbon atom ring structure where the methyl groups are attached to it, and this also has the, we can say it is a selective muscarinic receptor agonist because it don't bind to the nicotinic receptors, and it is also not hydrolyzed by the acetylcholinesterase enzyme, but unfortunately it is not having any clinical use. The other drug is pilocarpine. So pilocarpine is also a selective muscarinic receptor agonist plant alkaloid, and this is used in the treatment of glaucoma. And if we see oxotrimorin, so oxotrimorin, it is containing 2 pyridine rings. So 2 pyridine rings, they are attached by a trans double bond membrane, and thereby the structure is a little complicated. That is the reason it is not hydrolyzed. The ring structures are not hydrolyzed by the acetylcholinesterase enzyme. So that is the reason they are susceptible for this hydrolysis. And this is also a selective muscarinic receptor agonist. And this oxotrimorin is also not clinically used. Let us see the other drugs, that is we can say the indirectly acting or else nicotinic receptor agonist or cholinergic drugs. The drug called edrophonium. So edrophonium is a drug which is acting at the neuromuscular junction. So it is acting on the nicotinic receptors which are present in the neuromuscular junction, and it is a short acting drug. So it is showing rapid onset of action, and the duration of action is also very short, and that it is used in the treatment or it is used in the diagnosis of myasthenia gravis. So it is a disorder where in order to diagnose this myasthenia gravis disorder, this edrophonium is used. The other drug is physostigmine. So physostigmine is a medium acting drug, or else we can say the T-half as well as the duration of action of this drug is almost about 1 to 3 hours, and it acts in the ganglionic side, or else we can say it acts at the post-ganglionic junction, and it is used in the treatment of glaucoma. That is the reason it is formulated in the eye drop preparation, or else it is used topically in the eye drop to treat glaucoma. The other drug is neostigmine. This is also a medially acting drug, or else we can say the duration of action of this drug is medium, and it acts in the neuromuscular junction. And this neostigmine is mostly preferred through intravenous route, and it is used in the treatment of or else we can say this is recommended to give IV in order to reverse the neuromuscular blockade, or else it is given orally even in the myasthenia condition, or it is given orally in myasthenia gravis. The other drug is pyridostigmine. So pyridostigmine duration of action is also medium, and it acts at the neuromuscular junction. So this drug is also used in the treatment of myasthenia gravis. And the other drug is ecothiopate. So ecothiopate as well as the parathion. So these are the insecticides which are having the cholinergic action. As these are insecticides, and because of the complex structure, their absorption is less, as well as the duration of action of these drugs is also large, and these act at the post-ganglionic site. But parathion is not having any clinical importance, or else we can say it even does not bind to the receptors, or it does not bind to the cholinergic receptors. So ecothiopate is one of the drug which is used in the treatment of glaucoma, and that is the reason it is used in the topical preparations of eye drops, whereas parathion, as it does not even bind to the receptors, it is used just as an insecticide, but it is having a property of cholinergic action. So in case of this insecticidal poisoning, so in poisoning which has occurred in the humans, this parathion is mostly given. Let us see the pharmacokinetics of these drugs. So what are the pharmacokinetics of these cholinergic drugs? So as these are the forms of esters, and they are containing a quaternary ammonium compound. So quaternary ammonium compound, ammonium group, the molecular formula of ammonium is NH4. So here the quaternary ammonium compound, out of the 4 hydrogen atoms, 3 hydrogen atoms are replaced with the methyl group, as well as one hydrogen atom is removed, and the ion charge, or as we can say the charge, is added to the nitrogen atom. So this is the quaternary ammonium group. So all these contain the esters of quaternary ammonium compounds, and that is the reason these are easily hydrolyzed by the enzyme called acetylcholinesterase, and that is the reason they are poorly absorbed in the GIT as well as into the CNS also. But methacholine is one of the drug which is resistant, or as we can say it is the only drug which is this is the drug which is not hydrolyzed by this acetylcholinesterase. Why? Because the methacholine, even though it is an ester of quaternary ammonium compound, it is not hydrolyzed by the acetylcholinesterase because of the structural modification when compared to the acetylcholine. So this is one of the characteristic feature of this drug. And the carbomic acid esters of carbachol and bethanechol, these are having much greater resistance. See, if we see the bethanechol as well as the carbachol, so the esters which are formed on metabolism of these two drugs, they are highly resistant, and that is the reason they are having longer duration of action. The drugs like pilocarpine and nicotine, so these are the nicotinic receptor agonists. So these are the naturally occurring compounds, and that is the reason they are well absorbed in the GIT as well as they are well absorbed in the CNS region also. Whereas if we see muscarinic, so muscarinic is a compound, or as we can say it is a quaternary amine compound which is obtained from the which is obtained from the mushrooms. So but even though it is having the cholinergic action, it causes toxicity or poisoning in the humans. So that is the reason muscarine is not clinically applicable. And the excretion of these the excretion of these cholinergic drugs usually takes place through kidneys. Let us see the mechanism of action of these directly acting cholinomimetics. So as I told you, these directly acting cholinomimetics, they interact either with the binding of acetylcholine towards the receptor, or they inhibit the release of the acetylcholine from the secretory vesicles into the synaptic nares. Here the muscarinic receptors are GPCR type of receptors, and these muscarinic receptors are of 5 types. But out of these, M1, M3 and M5 show similar action, and M2 and M4 show similar action. So if we see M2 and M4 type of receptors show inhibitory actions. So these, what does this do? These type of receptors, they inhibit the enzyme called as adenylyl cyclase. So because of the inhibition of this adenylyl cyclase, there will be decrease in the cyclic AMP levels. So GPCR is mediated through cyclic AMP and IP3 and DAC pathway. So these two type of the receptors, they differ from other receptors on the mechanism of action they undergo as well as the effects they show. So because of the decreased cyclic AMP levels, they show inhibitory effects. As well as if we see M1, M3 and M5 type of receptors, they show excitatory effects as they are undergoing a mechanism of inositol triphosphate pathway and DAG pathway. So because of the increased activity of these two compounds, they show excitatory effect. Let us see about nicotinic receptors. So nicotinic receptors are ion channel receptors. So these ion channel mediated receptors, any ion channel receptor, it has to undergo 3 stages. So inactivation stage, open stage and closed stage. So the entry of the molecules or the entry of the ions through the receptor will take place only when the receptor is in open state. So if it is in closed state or if it is in inactive state, then the entry of ion state will not take place. So if the entry of ion is not taking place, then the depolarization of the membrane will not take place. So if the depolarization of the membrane is not taking place, the impulse conduction is not observed, thereby there will be no effect. So that is the reason, if the entry of sodium and potassium in the open stage of the receptor, it occurs depolarization of the receptor, and in the skeletal muscle it shows action potential, and thereby because of the action potential which is observed in the skeletal muscles, it causes skeletal muscle contraction. Let us see about acetylcholine. So acetylcholine is a compound which is having a quaternary ammonium group. So here if we see the nitrogen group, it is attached with 3 methyl groups and it is having a positive charge on it, and that is, it is the ester of acetic acid as well as choline. Here the synthesis, storage and release and inactivation. So what does this mean? So acetylcholine is a naturally occurring, or as we can say, acetylcholine is synthesized in the body itself because it is a naturally occurring neurotransmitter. So this acetylcholine is formed from the acetyl coenzyme A as well as choline with the help of an enzyme called choline acetyl transferase. And once the acetylcholine is formed, it is stored in the vesicles, and thereby the metabolism will take place. So after the metabolism, it binds to the receptors and uptake mechanism is taking place. So this is a cyclic process. So whatever the leftover acetylcholine, it goes and it is again released. And after the metabolism of this acetylcholine, it is degraded into acetic acetate as well as choline. So whatever the choline compound which is formed because of the metabolism of acetylcholine, it is aiding in the synthesis of acetylcholine also. So here the choline is reused again for the synthesis of acetylcholine. Let us see the pharmacological actions. So the acetylcholine, when it's binding to the muscarinic receptors, it shows various actions, and when it is binding to the nicotinic receptors, it shows various actions. Even the drug as such, if they are binding to the muscarinic receptors, they show one kind of action. If they are binding to the nicotinic receptors, they show other actions. So the pharmacological actions are categorized as muscarinic actions as well as nicotinic actions. Let us see the actions of these muscarinic receptors. So these muscarinic receptor location differs. So if we see the action of these muscarinic receptors on eye, so especially in the eye, the M3 type of receptors are present. So because of the these parasympathomimetic, or as we can say the cholinergic drugs, if they bind to these M3 receptors, it causes constriction of the pupil. So it causes constriction of the pupil as well as the sphincter, papillary sphincter muscles which are present in the eye. And apart from that, it causes spasm of accommodation. We can say it causes the contraction of the ciliary muscle. So if there is any excessive contraction of the ciliary muscle, then there occurs spasm of the accommodation, and thereby the vision will be, or as we can say the vision can be impaired. In the eye, it causes spasm of accommodation. We can say the ciliary muscles which are present in the eye, they undergo contraction leading to the spasm of the accommodation. So because of that, because of the constriction of the ciliary muscles, it may lead to lacrimation. In the sense, there will be excessive secretions of the lacrimal glands, and we can say the conjunctival hyperemia. I mean, there will be the conjunctivitis condition, and there will be decrease in the intraocular pressure. If we see the effects on cardiovascular system, in the cardiovascular system, M2 type of muscarinic receptors are present. So in the cardiovascular system, what are the effects we can observe? So one thing, it leads to the increased contraction of the heart, increased heart rate, and it shows negative inotropic effect. So inotropes are the compounds, or as inotropes are the agents which show the decreased heart rate. So these are negative inotropic agents. In the sense, they increase the heart rate, that leading to the bradycardia condition, and it shows negative dromotrophic effect also, that is the conduction of impulses through the AV node. So we have SA node and AV node in the heart. So the impulses which are conducted through the AV node can be decreased because of the action of M2 receptors, and these are vasodilatory in effect. So these show vasodilation effect which will bind to the M2 receptors. If we see in the respiratory system, M3 type of receptors are present. So these cholinergic drugs which will bind to M3 receptors, they causes bronchoconstriction. So first thing, there will be bronchial smooth muscle contraction, as well as there will be the secretions from the bronchial glands will be increased. So if we see the GIT, the changes or the effects of the cholinergic drugs in the GIT. Here in GIT also M3 type of receptors are present. So in GIT, the the smooth muscle tone can be increased, or else we can say the contraction of the smooth muscle is increased. Because of that, there will be increased motility, and the relaxation of the sphincters. What are the sphincters which are present in the GIT will be relaxed, and there will be increased tone of the muscle. If we see in the urinary bladder also M3 type of receptors are present, and it causes contraction, or as we can say the smooth muscles which are present in the urinary bladder are getting contracted, and here also the sphincters are relaxed. So because of that, because of the increased contraction and relaxation of the sphincters, it leads to micturition. If we see the other effects on the exocrine glands, in the exocrine glands also M3 type of receptors are present, and because of the stimulatory action of this M3 type of receptors, it causes increased secretions out of these exocrine glands. So for example, the glands like salivation, sweat, as well as lacrimation. So these are few of the exocrine glands, where on stimulation of these M3 receptors which are present on these glands causes increased secretion out of these glands. And the central nervous system. So in the central nervous system, the M1 type of receptors are present. So on stimulation of these M1 type of receptors, it causes the CNS excitation. So as I told you, M1, M3 and M5 show excitatory effect, and M2 and M4 show inhibitory effect. So there will be CNS excitation. And if you see in the peripheral nervous system and in the neuromuscular junction, so these are the junctions or the places where the nicotinic receptors are present. So in the peripheral nervous system, it causes the stimulation of ganglia, but thereby the systems are getting activated. So in the peripheral nervous system, the ganglia, even the both systems, in the peripheral nervous system, both two types of nervous systems are present. So in these two type of nervous system, whether it may be autonomic nervous system or somatic nervous system, these gets activated because of the action of these cholinergic drugs. And if we see in the neuromuscular junction, because of the entry of sodium and potassium into the cell rapidly, it causes depolarization of the cell, and it leads to skeletal muscle contraction. Let us see the therapeutic uses of these drugs. So these drugs are therapeutically used in glaucoma. For example, the drug called pilocarpine. So pilocarpine is a naturally occurring plant alkaloid, and this is used to treat glaucoma, and they are used in the accommodative estropia. So accommodative estropia is a condition where we can say there will be crossing of the eye, or else the focus of the eye look, or else the contact of focus of the contact of eye will be crossed, and there will be induction of meiosis. Meiosis is again a condition where there will be blurred vision, and that is observed through acetylcholine and carbachol, and there will be post-operative ileus because of the drug called bethanycol. So after even the removal of ileus, because after the surgery of removal of ileus also, this bethanycol shows in these conditions the bethanycol is used to show cholinergic effect. And it is used in congenital megacolon, and the drug which is used in congenital megacolon is bethanycol again, and this bethanycol, apart from this, it is also used in the neuropathy condition. So in the neuropathy as well as in the diabetic we can say it is used in the diabetic neuropathy condition. So in diabetes also this bethanycol is used to show its anticholinergic effect, and these bethanycol, or as we can say these cholinergic drugs, are used to treat the dry mouth in Sjogren's syndrome. So this is one of the syndrome where there will be dry eyes as well as dry mouth. So in this condition, to treat this, this bethanycol is used, because anticholinergic drugs, or as we can say parasympatholytics, have side effect of dry mouth. So as these parasympathomimetics, they show quite opposite effect of this parasympatholytics. So they are used in the treatment of dry mouth, and they are even used in the treatment, or we can say they are used in the diagnosis of the hyperreactivity, or the bronchial hyperreactivity. In conditions, they are used in the diagnosis. So the drug which is used in the diagnosis is methaqualone, as it is not having any clinical effect. What are the adverse effects? So what happens if the cholinergic drugs are given in increased dose? So in increased dose, they causes over secretion of, or as we can say over secretion of glands like salivation, over sweat as well as lacrimation, and there will be difficulty in visual accommodation. So as there will be excessive lacrimation, the vision of the person will be impaired, and it causes NVD, that is nothing but the nausea, vomiting and diarrhea because of the abdominal cramps, as these show the contraction of the GIT muscle because of the excessive contraction of smooth muscle which is present in the gastrointestinal tract. It shows nausea, vomiting and diarrhea. It's used in urinary urgency and bronchoconstriction, cutaneous vasodilation and hypotension. Contraindication. So when does these drugs should be contraindicated? So these drugs should be contraindicated in bronchial asthma because they cause constriction of the bronchial muscle, GI or urinary tract obstruction, peptic ulcer. Why? Because these cholinergic drugs, they aid in the excessive secretion. So if these cholinergic drugs are given with in peptic ulcer condition, then they aid in the excessive release of HCl, where the peptic ulcer condition can be worsened. And it is used in myocardial infarction, which is, this is the research which is reported very recently, and coronary insufficiency and hyperthyroidism. Let us see the toxicity. What happens? See, nicotine is a nicotinic receptor antagonist. So what happens if the nicotine toxicity takes place? So this nicotine toxicity can occur in two stages, acute as well as chronic stage. So what happens in the acute stage of nicotinic toxicity? So in the acute stage, it causes the CNS stimulation. There will be excessive stimulation of CNS, thereby it is leading to convulsions. So if excessive CNS stimulation takes place, it leads to seizures or convulsions, whereby the person may go to coma, or sometimes it may lead to death also. And it is used it shows the skeletal muscle depolarization. If there is any excessive depolarization of the skeletal muscle at a certain stage, it leads to paralysis or spasm of the skeletal muscle, and it is it even causes hypertension as well as cardiac arrhythmia. Let us see the chronic effect. Chronic tobacco use or chronic nicotine use. So this tobacco contains nicotine. So what happens if we consume tobacco for longer period of time, and or else what is the effect of this nicotine for longer period of time? So it causes increased risk of vascular disease. So if a person is consuming nicotine for longer period of time, it may lead to various cardiovascular disorders, and it may lead to sudden death of the person because of the increased activity of the parasympathetic nervous system. It may lead, or as we can say, the paralysis of the vascular smooth muscle takes place, thereby the functioning of heart is impaired, and it causes the aggravation of peptic ulcer in smokers. So person who are having frequent habit of frequent smoking, then the peptic ulcer can be occurred. If a person is already having peptic ulcer and he's still smoking, then it may worsen the condition of peptic ulcer. Let us see the drugs. So methaqualone. So methaqualone is a muscarinic receptor agonist, as it binds to the muscarinic receptors and it exerts its actions mainly on CVS as well as GIT. So in the cardiovascular system, it shows increased heart rate, increased force of contraction of the heart, and increased smooth muscle contraction. If we see in the GIT and urinary bladder, it causes the increased secretions of GIT as well as increased smooth muscle contraction of GIT and urinary bladder. The duration of the action of this methaqualone is short. It's only for 30 minutes and it is mainly used in paroxysmal atrial tachycardia. Let us see the other drug, carbachol. So carbachol is one of the drug which is not even metabolized by the, or else we can say it is not hydrolyzed by the acetylcholinesterase enzyme. So that is the reason, because as it is not hydrolyzed, it is having longer duration of action and it is a potent we can say it is a potent muscarinic receptor agonist when compared to other drugs. And it uses, the carbachol is mainly used in the post-operative abdominal distension. After there is any surgery to the abdomen, this carbachol is used, and it is used in paralytic ileus. If there is any paralysis which is occurred in the ileus, this carbachol is used, urinary retention as well as glaucoma. Let us see the bethanechol. So this bethanechol is hydrolyzed by the acetylcholinesterase enzyme. So that is the reason it is having very low, or as we can say it is a weak drug, which is showing weaker effect. But as it is easily hydrolyzed by the acetylcholinesterase, but if it is present in the body, then the duration of action of this drug is for longer period, or else we can say the effect which is shown by this bethanechol is prolonged. Even though after it is hydrolyzed, the effect of bethanechol can be observed, and it is therapeutically used in micturition as well as gastric retention after the surgery. The other drug is pilocarpine. So pilocarpine is a plant alkaloid, or else it is a muscarinic receptor agonist which is obtained from the plant source called Pilocarpus microphyllus. So in Telugu it is called as Jaborandi. So this is the common name of this pilocarpus drug, and this pilocarpine, if we see the structure of pilocarpine, it contains tertiary amine esters. So it contains tertiary amine esters in the sense it is having a nitrogen group with two methyl groups, 2 or 3 methyl groups attached to it. If it is having 3 methyl groups, then the charge is not present. If it is having 2 methyl groups, then a positive charge is present on the nitrogen atom. And this is markedly observed to have CNS effects. What are the therapeutic uses of this pilocarpine? So this pilocarpine is mainly used in the treatment of glaucoma, and it is used to reverse the condition of mydriatics. So these cholinergics mainly show miosis. So that is the reason, in order to reverse the effects of mydriasis, this pilocarpine is mainly used, and it is used in xerostomia. So this is a condition where we can observe the dry mouth, and we can if there are any breakage in the adhesions of the tissues, then this pilocarpine is recommended.